Hey guys, welcome to the Health Babes podcast. I'm your host, Dr. Becky Campbell and Dr. Crystal Hone. Today we have Dr. Jaime Seeman on. She is a board certified obstetrician and gynecologist practicing in Omaha, Nebraska. And Jaime has an awesome new book out called Hard to Kill. And we talk all about her new book. And we talk a lot about the transition from perimenopause to menopause. So many different things we talked about, what your diet should look like, hormone replacement therapy, what labs are important to check. And then we just really dive into her book and all the different pillars that are in her book. So we hope you love this episode.
Well, we have Dr. Jaime here. Thank you so much for coming on. We appreciate it. Welcome.
It's so great to be here.
Yes. So we're going to get into your awesome new book and, Hard to Kill, but I want to talk to you a little bit about hormones to start this off, because we take care of a lot of, women that are in their perimenopausal years, transitioning into menopause, and we get so many questions about that, right? So can you kind of go into the changes that happen from perimenopause to menopause and what that looks like for women?
Yeah, absolutely. So let's kind of set the stage for perimenopause first. So basically, as a XX, a female baby, we are born with ovaries, and we're born with what we believe to be all the eggs we'll ever have in our lifetime. Some of the new stem cell research coming out shows that maybe that's not quite the case, but it appears that we're born with basically a couple million eggs inside of our ovaries. And as we reach menarche, when we start menstruating, when we enter these years of fertility, essentially what's happening is the brain is recruiting a certain number of these primordial follicles in the ovary. So the brain is saying, hey, who wants to come to the party this month? And then 10, 20, 40, 50 people raise their hand, and they start developing into these primordial follicles, and they start maturing. And then at some point, one becomes the chosen one. And that is the follicle that develops generally about 2 to 3 centimeters in size, which I think is a myth. A lot of people they hear the word cyst on the ovary and it's immediately pathologic. I get consults all the time from the ER. This woman has a cyst on her ovary. I'm like, duh, she's menstruating. So they make this 2 to 3 centimeter cyst, and then this egg gets released, and then where it was released from turns into a corpus luteum. And what's happening during this process is that during the first 2 weeks of the menstrual cycle, we're making lots of estrogen. And then after ovulation, as this turns into a corpus luteum, we're making predominantly a lot more progesterone in the luteal phase. So what's happening when we say this word perimenopause is basically, as the brain is trying to recruit these follicles each month, there's less and less people available to invite to the party. Everybody's moved out of town. Yep. And so they're having trouble recruiting all of these little follicles. And so this is when we start to see changes from a month-to-month basis in hormonal production. So the production of estradiol, the production of androgens like testosterone, not usually as much as we do estrogen, but estrogen is actually made from testosterone. So that's a big deal. If they're not making androgens, then they can certainly be lacking in estrogen. And then of course, with this ovulation, if we're not having this release of this chosen egg, or even if we are, the corpus luteum production of progesterone starts to lag. And so that's the definition of perimenopause, is basically we're starting to have some changes in the communication between the brain and the ovaries. It's having a hard time getting people to come to the party, getting one to be released, and then subsequently producing this progesterone. And progesterone is literally a hormone of pregnancy. So as a fertile species, essentially every single month, our body is anticipating a pregnancy, which is why we see, and we can dive into the physiologic changes that happen during these cycles. But it's basically trying to prepare the body for new life. And then the clinical definition of menopause is when you haven't had a period for 12 months. So that's basically for 12 months, your brain has been screaming at your ovaries to try to get one of these eggs released, and there's no more, likely no more. And, really ovaries are this is like the hallmark of aging, because when women go through this perimenopausal transition and eventually menopause is when we see some major physiologic shifts within the body that increase the risk for chronic disease and basically accelerate the aging process.
Yeah. And, everyone talks about estrogen. You see it kind of everywhere. And, everyone wants to know about estrogen and should it be high? Should it, is it too high? Is it too low? Like, what is its main role and all that? So, what role does estrogen have in metabolic health?
So first of all, when it comes to testing hormones is hard because in women, they're changing from hour to hour. They're changing depending on the day of your menstrual cycle, where you're at in your menstrual cycle, and really what your age is. So testing is difficult. Estrogen is an amazing hormone. I think it gets a bad rap sometimes when people throw around terms like estrogen dominance or estrogen causes breast cancer. People are like, ooh, estrogen. But estrogen is great. And it's not only great for women, it's great for men too. The role that estrogen plays is far and wide in the body. We have estrogen receptors in our brain, for instance, and we know that the loss of estrogen increases risk of mild cognitive impairment and dementia. So as we go through perimenopause, women start to experience trouble with short-term memory, can't forget where I put my keys. They just can't find the thought. They can't remember what they were going to say. They have trouble staying focused. So that's the role, that estrogen plays in the brain. Estrogen plays a role in our cardiovascular system and in our heart. It actually reduces your risk of cardiovascular disease by having estrogen. It's quite protective to our cardiovascular system. And this is why when women go through menopause and they suddenly have loss of estrogen, they start increasing visceral fat deposition and they start increasing risk of atherosclerosis, heart disease, and just cardiovascular disease across the board. And I lump kind of things like diabetes and cardiovascular disease and all these things kind of into one basket because they're all related kind of deep down at the level of the mitochondria. So basically we know that estrogen plays a role in our mitochondrial health. It actually changes gene transcription within the mitochondria when we have loss of estrogen. And basically women start to become more insulin resistant, and it's that insulin resistance and mitochondrial dysfunction that basically drives their risk of the chronic diseases like diabetes, heart disease, and cancers too. We have estrogen receptors in our bone. So as women lose estrogen and androgens like testosterone at time of menopause, they start to demineralize their bone at a faster rate. We reach our peak bone mass very early in life, and then it's this slow decline, but it accelerates after you lose these hormones. Hormones play a huge role in our bone health. But we have estrogen receptors everywhere. So they'll notice even change in skin texture. They'll notice change in hair texture. They're literally every cell, even our thyroid gland has estrogen receptors. So when you go through menopause and you just have this sudden decline where you were going from anywhere from 50 to 250, level of estradiol on any given day of a month during your years of fertility, to postmenopausal, we're talking usually less than 30, less than 25. I've seen estradiol levels of 0 very commonly in postmenopausal women. I mean, when you go from that to 0, women are feeling the impact of that.
Yeah. So can you talk a little bit, so especially when women are transitioning into menopause and they're seeing that estrogen decrease, right? We hear so much about hormone replacement therapy. Can you talk a little bit about, prevention, not reversal, right? When it comes to these symptoms and these things that we can be doing. So tell us a little bit about hormone replacement therapy and how women could utilize that.
Yeah. So, I came through a time in my training when it still was not super popular. Therapy, the WHI trials in the 90s and the early 2000s scared a lot of my colleagues away from the use of hormone replacement therapy. And so when I came through training, it was like you gave it if the woman had hot flashes and only for as long as it helped her hot flashes. And then you got her off it as quickly as possible. That was like, basically what I was taught, when I came through. And now we're kind of seeing the pendulum definitely swing the other way. I think we realize the role that estrogen plays, like I just described, in our brain, our heart, our bones. And so it's not just for the things that you can see and feel, right? Like hot flashes, vaginal dryness, but there definitely seems to be a role in prevention of age-related chronic diseases. So, you may make the argument, well, then let's just give it to all women. Well, it's certainly still very individualized, depending on, what your current health status is, what your family, history and risk of things like breast cancer are. But in perimenopause, as we start to see these, I call the levels psychotic. I mean, 1 month it's high and then it's low, and then it's high and then it's low. It's a hard time to replace, right? Because if you have a lot 1 month and I give you more, it could make things worse. So, but there's definitely a time and a place to start hormone therapy. And it seems to be during perimenopause and for sure 10 years after menopause. When you kind of said prevention and not reversal, that evidence is pretty clear. So although I'll tell you, I mean, I can give you kind of a case example, but basically, if you're going to use hormones, you should start them at menopause. You should think about being on them for at least 10 years after menopause. And then after 10 years, then you really have to have a risk benefit discussion with your provider, because the average lifespan is somewhere in the 70s. And so, statistically speaking, you're maybe only going to live another 10 years. Would it be worth it to be on it? If you're somebody like me, I plan to live to be 100.
Love it.
I think you will, Jamie.
I think you will too.
Pry the estrogen out of my hands at 62. And so, that's where it's such an individualized, thing for people, because I don't know how long you're going to live. And I definitely have patients that are in their 70s and 80s that still are on hormone replacement therapy, as long as they understand, the risks and the benefits of doing that. But the story I had about reversal is, basically, if you show up and you've got, serious atherosclerotic disease and you're demented and your bones are brittle and soft, suddenly putting you on estrogen therapy is not likely going to make your quality of life or those diseases significantly better as far as, impact of and outcome of that. But certainly it can delay the onset of these types of things. And that's why it's important to start having that discussion around perimenopause. And when you go through menopause and kind of deciding if that's something that you want to do. I did have a patient that came to me in her 60s. So she was kind of at that mark. Now she's 10 years past menopause, and she had never initiated therapy. And she had pretty significant osteoporosis, and she had been treated by multiple different physicians on lots of different osteoporosis medications. And for those of you that don't know, there's lots of side effects. There's very significant risks, necrosis of the jaw, lots of bad things that can happen with these types of medications. And she'd kind of experienced all of them essentially, but she was in otherwise pretty good health. I mean, it was really just her bones. And she wanted to have a discussion about hormone therapy. And so, we had this exact discussion, it's not necessarily as great at reversal, but she decided to initiate both estrogen and testosterone replacement therapy. It's not an FDA approved treatment of osteoporosis. I'll just make that really clear. But in her, we were able to follow DEXAs, and she actually was able to reduce her scores. I mean, significant remineralization of her bones. And wow. I was actually she was of course happy, but I was even happier, I think. And so it was pretty amazing. I basically put her on a resistance training program. We optimized estrogen and testosterone levels. We got her on some D3 and K2. She was getting lots of sunlight. We manipulated her diet. I mean, there's lots of things that are multifactorial in these disease processes, and her scores got way better. I mean, for somebody in their late 60s, I was super happy with that, because if I would now reduce the risk of her getting a hip fracture, right, that's significant, because after the age of 65, if you fracture your hip, your risk of death in the next year is like close to 30 to 40%. Like, that's big time. So that's why it's important to think about these things earlier rather than later.
What do you think about women, late 30s, early 40s wanting to do hormone replacement therapy?
Well, I think that a lot of patients come in thinking that their problems are, quote, hormonal, there's something wrong with my hormones. That's why I feel so crappy. That's why I can't sleep and I'm stressed and I'm overweight, or, whatnot. And it's really probably the other way around. It's really probably, the things that I talk about, basically how you eat, how you move, how you sleep, how you recover from stress, and your kind of like what I like to call like environmental, burden, people, places, and things that you interact with on a daily basis. I think those things are what's causing hormonal imbalance, and not the other way around. It's like the chicken or the egg analogy.
Right. Yeah, we kind of do that too. We try to look for all the other things, when they're in that age group of, what is causing that, are you to feel this way? It's not, you need to take estrogen necessarily. It's like, how stressed are you? What are you eating? Are you sleeping? All that stuff.
Yeah, absolutely. Because those things absolutely impact this communication between the brain and the ovary. Like we talked about, every month when your brain is shouting at your ovary, these things are causing interference in that communication.
Yeah.
Yeah. So let's talk about how diet is so important for our metabolic health, especially, for, women too, as we're transitioning into those menopausal years. What types of foods do we need to be eating? What's important here?
Yeah. So from my perspective with nutrition, there's really, a couple of things there. First of all, calories. Let's just talk about energy in general. Calories matter when it comes to, it's like your bank account. Listen, if you've got more money flowing out than you have flowing in, you're going to be in debt. And vice versa. If you're saving a lot of money, your bank account's going to grow and you're going to be rich. Now, when it comes to body composition, calories matter, and too much or too little can be a stress on our system as a woman, because we're a reproductive creature. So if you have too little nutrition coming in, your body may say, this is not a good time to create a new life, and I'm going to stop the system and not release an egg. And then vice versa. If you have too much stored energy and you've got inflammation and you've got diabetes or, some of these other diseases, it's going to cause dysregulation with our hormone production. Now, when we think about the calories we eat, basically there's these three macronutrients: protein, fat, and carbohydrates. From my perspective, to make this as simple as possible, protein and fat are basically the only two macronutrients that are a requisite for life. You absolutely have to consume fat and protein in the diet or you will die.
Yeah.
Carbohydrates are not essential for human life. Our body has the physiologic capacity to make carbohydrates from protein and fat substrates. Now, with that being said, ketogenic and low carb diets can certainly cause problems for some women if you eat too few of carbs. So where do people find kind of the right place? Well, when it comes to protein, women are under eating protein across the board. I don't know why. I don't know if it's that less women, that meat is like more of a manly thing or what it is, but I find that when I have patients do a 24-hour dietary recall and I calculate how much protein they're getting in a day, most of them are not even getting the recommended, daily allowance that is currently recommended, which in my opinion is also too low.
I know.
The recommendation for protein, at 0.8 gram per kilogram is basically the minimum to prevent major problems. But if you're talking about optimizing your health, if you're talking about optimizing your function, if you're talking about being hard to kill, essentially, you should be eating at a much higher level than that minimum. I'm talking about levels up to like a gram per pound of body weight. So just for people's reference, I'm 160 pounds. That's 160 grams of protein. That's a significant amount of protein. And for people that are older, people that are sarcopenic, people that are going through major metabolic diseases, they might even need more than that. So grandma needs more protein than the grandkids at the Thanksgiving table. And that's a really big thing for a lot of women to wrap their minds around. It's a lot of protein. So then essentially you set protein very high because it's hard to get fat and overweight by eating too much protein. It's very satiating, and you are assuring that your body has an adequate level of amino acids, specifically something called leucine, which is an amino acid that stimulates muscle protein synthesis. And we'll kind of tie this all together, but basically when it comes to aging well and longevity, you want to have a lot of muscle mass. So you've set protein really high. Your two other, I call them energy substrates, are essentially fat and carbs. So now you have to decide which horse you're going to ride here, because I think it's really hard for people to eat a balanced diet of fat and carbohydrates. It can definitely be done. But I personally come from a place, I used to have pre-diabetes. So I personally subscribe in my own life to a low carb lifestyle. But I want people to understand about carb consumption is that I think that people should start low and then go up and find their threshold. And for women that are making this transition into perimenopause and into menopause, they're going to find physiologically that they don't tolerate carbohydrates in their 30s, 40s, and 50s like they did when they were younger. As teens and 20s, we're very active. We generally have decent body composition. Maybe we're in sports and athletics. and our tolerance for carbs is much higher. As we age, that tolerance is way less, especially if you don't have muscle. So all the more reason to work on building lean mass, because muscle is a great reservoir for carb consumption. If you're like me and you like to eat.
Yes, amen to that.
Yeah. But we have to be really cautious with overconsumption of carbs, because consumption of carbohydrates, abuse of carbohydrates, and unfortunately, that's what most processed manufactured food is made of, is low quality fats and processed carbs. It will drive your risk of all the things that are going to make your life miserable, which are the three killers, right? About 80% of deaths these days are cardiovascular disease, cancer, and neurologic diseases. And then when it comes to fat, fat's gotten such a bad rap, when we really, really wanted to blame saturated fat on heart disease. I grew up in an era where it was low fat. I was eating hot tamales because they were low fat.
Yep.
We just thought if it didn't have fat in it, then it was healthy. And that's where you see cereal boxes with the American Heart Association stamp of approval, because it's a low fat food, which is garbage. You heard me say that fat is something that is required for life. We have to eat fat to survive. Our sex hormones, testosterone, estrogen, progesterone, are literally made from cholesterol.
Yeah.
And so if you're not getting that in your diet, your body is going to take it from substrates inside your body. And we've all seen, bodybuilders, like these big jacked men and women, right? They look really lean and mean. These people eat extremely low fat diets. And I have seen these patients in my clinic, estrogen levels of nothing, testosterone levels of nothing, because they're eating really low calories and really low fat. And that can definitely hurt our fertility as well. So basically, when it comes to nutrition, energy matters, calories matter. Figure out which energy substrate is better for you. Overconsumption of fat is a real thing too. I want to throw that out there. People eating low carb diets and just eating boatloads of fat, implications to that too. I think there's probably some genetics at play when it comes to what types of fats some people do better with more saturated fat. Some people do better with less saturated fat. But when we look at the monounsaturated and polyunsaturated fats, the majority of polyunsaturated fats in the American diet come from processed foods, because there's the addition of soybean oils, sunflower oils, canola oils, easily oxidized, highly inflammatory, and people are deficient in more omega-3s in the diet. So eating more fatty salmon, fresh caught, wild salmon, and these other good sources of omega-3s in the diet. But when it comes to nutrient density, eating whole foods, I don't care if you want to be a vegan or a carnivore or somewhere in between, but eating real whole foods that grew in the earth or had a mother, you're probably going to be doing okay.
Yeah.
I think we all can agree that ultra processed food, including some of this new plant-based garbage, is really bad for our health.
Mm-hmm.
And that's one of my fears, really, honestly. I just had a patient today reach out to me. She had to find a new PCP, and she went to this doctor, and the very first words out of their mouth was that they should eat a plant-based diet. And I think that is a really political statement. I think that the more we push a plant-based diet, a plant-based agenda, for whatever reason it is, I think it will honestly scare people away from eating nutrient-dense animal foods like red meat, which has a very healthy place in the diet, and it will push them towards eating ultra-processed foods more. That's my personal opinion.
For sure. I feel so much better. I eat a good amount of protein. Like my body wants animal protein. That's really the only thing I can tell you that I actually crave is animal protein. And I'm not carnivore or whatever, but I do eat a lower carb diet naturally, because that's what I like. My body likes that. So
when it comes to satiety, I remember when I was a carbaholic. I was addicted to carbohydrates. I was constantly thinking about my next meal or snack. It literally drove my entire day, just like dreaming of food, thinking of food, just absolutely mind consuming. When you start eating higher amounts of protein, the satiation of that is incredible. Pair that with actually eating quality fats too, and it's amazing. I can be in the operating room operating multiple hours right through the lunch hour, and I'm not like running out of the operating room looking for something to shove down my throat. It's really incredible when you give your body the building blocks and the nutrients that it needs, how it will actually take care of you.
Yeah, carbs don't hold me over at all. Like I am protein, fat make me feel great, and for a while. So yeah, I totally agree. Okay. So when we're talking about looking for like the key markers, if you're looking for, assessing metabolic health in a patient, what are some key markers you're looking for?
Well, I think you can get really basic labs and kind of determine where you're at. Like literally just a fasting glucose, a fasting insulin, an A1C, and a fasted lipid panel. Like that in and of itself is going to tell you if you're insulin resistant and what you're looking for. A high fasting insulin level. Most labs are going to say the cutoff is 10. I love to see fasting insulin levels closer to 5. Fasting glucose level. Most labs are going to say normal is less than 95. I'll be real honest. I think most people should have a fasted glucose level in the 70s to 80s. You can look at those two numbers too and calculate something called an insulin resistance index. The clinical utility, I don't know. I think it's there. I like looking at it. A hemoglobin A1C is a 3-month average of your blood sugars. This is the last thing to start to rise. You're going to see abnormalities in your fasted glucose and insulin before they're in the A1C. But if you check that thing and it's above 5.7, major red flag. And listen, the cutoff is 5.7 for prediabetes, 6.5 for type 2 diabetes, but this is an absolutely linear relationship. And we know this from pregnancy data too. It's a linear relationship, meaning if it's 5.6, it doesn't mean you're good. It means you're darn close to being in trouble. And so the further away you can get from that, the better. Now, okay, we don't need to go to the extremes. You don't need an A1C of like 4.2, but mine's 4.9, just for everybody's reference. And I eat a higher percentage of protein, so it'll probably never be lower than that. But that's a red flag if it's high. So check that. A fasted lipid panel. Most people are probably thinking they're looking at total cholesterol and LDL. I don't look at that as much. I definitely look at the triglyceride to HDL ratio. So your triglycerides are literally your blood fats. And as those get high, the normal range is less than 150, but to be honest, it should be a lot lower than that. I think that's too liberal. And your HDL, which is your quote unquote good cholesterol, you would ideally like that ratio to be 1-to-1. So basically, if your triglycerides are 60, your HDL is 60. And I'll tell you, that is rare to find. That is rare to find a good ratio like that. But I think that's a very basic way to say, how am I doing metabolically? There's certainly tons of other labs to check. Depending on how much money you want to spend and what insurance will cover. So that's why I don't like to draw a bunch of labs that we're not going to do anything with. I'm a total nerd and I would draw a 9-page panel on myself just for fun. But I think that's just a really easy bit. Like you could literally get your doctor to order those things very easily without a lot of explanation.
They typically do, except for an A1C. I don't see A1C drawn as much as I'd like to.
Gotta ask for it.
But yeah, we always look at triglycerides too. We like them under 100.
Same.
So let's talk about your book, Hard to Kill. And you talk about these pillars of health that we all need to be focusing on to be hard to kill. So get into that a little bit. I'm excited.
I think it's kind of self-explanatory. It's like, what can you do in your daily life to be harder to kill, right? Because here's the truth is we're all dying. And we have our lifespan, which is the day we're born until the day we die. We're all guaranteed after, I always say, the book basically starts off as an OBGYN. I deliver this baby. Literally the only thing this baby is guaranteed in life is death. That's it. And so we're all going to die sometime. And we know statistically, depending on where you live in the world, how long you might live. But when we look at the things that are most likely to kill us and make us miserable, heart disease, cancer, neurologic disease, most of these are lifestyle problems. So what can we do to live a long life, but not only a long life, but in the last 10 years of our life? I always say, like, what do you want the last 10 years to look like? Do you want to be in and out of doctor's visits, going to the pharmacy, filling prescriptions, living in a nursing home, having people care for you? Or do you want to be out vacationing, spending time with your grandkids, practicing medicine? I mean, maybe I want to practice till I die. I don't know. But what do you want to do in those last 10 years? And then what is it going to take to get there? Because you have to start working really early at these things. It's also never too late, just so everybody understands. But the pillars of health, essentially for me, and these are things that I talk to patients about all day long. These are things that I literally do in my own life. This is not magic, but I think that we sometimes really get into the weeds, especially in like functional and integrative medicine, the weeds of like, different testing and all these things when people aren't doing the basic simple things. And the basic simple things Yeah, the basics. Number one, nutrition. This is something we do every single day. We do it multiple times per day. So when you want to talk about making an impact on your health, I would start with nutrition. Get your diet in a good place. Get rid of all the ultra processed foods. Focus on nutrient dense animal foods, proteins and fats. Figure out where your carbohydrate threshold is and lock that in, and understand that when you do that, you're going to start to function on a whole nother level. Your brain's going to start working better. A lot of the problems that you think you have, your hormonal problems, your acne, a lot of these things are going to start to resolve on their own. The second pillar is basically exercise and movement. All exercise is great. You want to go for a walk, you want to go for a jog, all exercise is amazing. But when it comes to being hard to kill, you want muscle, you want lean body mass. I gave that statistic about a broken hip after age 65. We know that the more muscle you have as you age, it really prevents you from getting the chronic diseases of aging, because what's happening is we focus so much on fat, on people being, obese, too fat. Most people don't have enough muscle. And if they change, especially for every woman listening right now, if you change your mentality of like, I just want to lose these 10 pounds, if you change your mentality to say like, I'm just going to get as strong as I can, I'm going to put on as much muscle as I can, I guarantee you that 10 pounds is going to take care of itself. And we focus on this weight scale that we all have in our bathroom, and it's not really telling us anything from a health perspective. What women really need to know is how much subcutaneous fat you have, how much visceral fat you have, which is the fat around your organs, and how much muscle mass you have. And those are parameters that you should be tracking from year to year. We have a gym here in town, my husband and I own, and we have a DEXA machine. And I think getting a DEXA on an annual basis and knowing those numbers would be far smarter than getting on the scale every single day. Just stay off the scale for 365 days and just scan yourself every year. You already know if you're putting in the work to make it better or worse. Most people, before they step on the scale, I mean, you know what I mean? Like, what is it telling you?
No, I know.
So yeah, so to do that, to gain lean body mass, to make your muscle strong and your bones strong, so you don't fall and break a hip when you're older, resistance training. Women have got to stop being afraid of the weight room. It doesn't take a ton of time or a ton of weight, for that matter, but you have to put a stress on the bicep. You have to tell the bicep, hey, I need you to be here. Because if you don't, it will atrophy way easier than it's way easier to lose muscle than it is to grow it, unfortunately.
For sure.
I know.
But if you get into a situation where you get in a car accident, you break your leg, or you get diagnosed with breast cancer, that muscle is a metabolic reserve for you, and you want it when you need it. And so you've got to figure out a way to do resistance training. I think personally 3 to 4 times a week. I think cardiovascular exercise is great. You can actually do a pretty darn good resistance training workout and get a pretty good cardiovascular workout at the same time, though, if you do, do it in a circuit style or something like that. But really, honestly, I think, high intensity exercise and sprinting are fantastic. And you only need a couple minutes. If you're going to work out for an hour, 2 to 3 minutes of very high intensity. And most people, what they think is HIIT is not really HIIT. I'm talking like all out 100% effort. And that will really start to change your body composition for the better. It will reduce your visceral fat too. Because exercise, it actually sends chemical messengers. The muscles are an endocrine organ, so is our fat, and they're all communicating with each other. So that's exercise. The third one is sleep. Sleep is, we think it's just something where we like lay our head down and literally go to sleep, and then we wake up. But when we sleep, there's so many amazing things happening inside of our body. Hormones are being produced, our body's repairing, regenerating, and we live in such a, keeping up with the Jones society, and people neglect sleep often. They're in your young years, you're staying out partying, got to be with friends, socializing, and then you get into your years of being a mom, not sleeping, you got a kid in your bed for like,
Lord help us,
2.5 years. now your kids are in activities, you're trying to, support the family with a full-time job. We just neglect sleep all the time.
Mhm.
And then it's too late. Then, we hit menopause and we're old and we're like, well, what now? So we have to prioritize sleep. And I talk about sleep hygiene, really what are the things you do in the hours before you go to bed? Because preparing for good sleep actually happens during the day. It happens by eating right, by getting sunlight, by preparing a bedroom that is a good environment for quality sleep. It's not too hot, the bedding's not too thick, the mattress isn't too hot, there's no animals in there, TVs in there, smartphones in there. So that's really what that pillar kind of focuses on. And then the next one is stress. And we're talking about physical, emotional, and spiritual stress, essentially. And stress is a good thing. Stress actually is where we grow and where we find growth in our life. And so stress is a good thing, but most people, if you ask them, they think stress it's a bad thing in their life. They are not dealing with it correctly. And so what this entire pillar focuses on is the mentality around basically being hard to kill, focusing on the internal language that we use within our brains, because our internal language is what drives our physical actions and the outcomes that we see in life. Also about creating mental resiliency. We are not resilient. Most of us are not very resilient, by nature. And this is something that has to be practiced and cultivated. And then when it comes to physical stress, like we have to remember exercise is a stress. So we can actually be overtraining, as well as being undertraining, but there's also other ways we can create physical resiliency. We talk about red light, we talk about cold therapy. These are what we call hormetic stressors. So ways that we can induce a little bit of stress in our body for growth. And so that's what that whole pillar dives into. And then the last one is basically our environment. So people, new circle, you be the people you hang out with. So if you want to be healthy, you should find really healthy people and just hang out with them and do everything they do. Find your idol and just be their shadow and follow them around. Because as humans, we like to be validated. And so if you're around people that are who you want to be, first of all, that's very validating to you. Second of all, you will just naturally start to do a lot of the things that they do, because socially that's an acceptable thing. Now, for better or for worse, if all your friends smoke and, eat fried chicken and whatever, you're going to do those things. You just will. Social pressure is real. And then places. So where you live, your water supply, your air quality, the materials that your home is built out of. These are things that people don't think of. And then things. So particularly for women, particularly as a mom of 3 daughters, sunscreens, makeups, lotions, soaps, plastic water bottles, plastic food storage containers. All of these things can really have a big impact on our health. And so you don't want to be eating right and lifting weights and then sleeping 3 hours and heating up your chicken and rice in plastic containers. We just have to kind of think full circle when it comes to being hard to kill. But the book also really acknowledges that at any moment, something could take me out tomorrow. That's just how it is. And it's about living the most robust, full life and just being thankful and grateful for every day that you wake up, that you get to be on this earth.
Yeah, I love that. So all of those things are so great. And that's why this book is so good, because it's all things you can do yourself at home without the help of somebody else, the testing and all that stuff that we talk about all the time. But you need to start with all these things first. And all these things are very, very important. So we love that.
Well, and I think that, what I want people to do with this information is do all of these things before you're going to your doctor. Can you just check a bunch of labs and scans? And I think it's my hormones. Do the basic simple things first. And then that's where medicine should come into play, once you're doing all those things.
Yeah, that's so true. Well, we love that. And we love your book and we love you. You're awesome. I've been following you forever. So if you guys have not followed her on Instagram, can you tell us where we can find you on Instagram and where else we can find you and where we can find your book?
Absolutely. I'm most active on Instagram at Dr. Fit and Fabulous. I'm on Facebook. I'm on TikTok, but let's be real, I'm not over there. But my website is www.drfitandfabulous.com. You can find a link to my book. I've got a new online academy that goes with the book where I'll be doing most of my private coaching and Q&A sessions and things like that. And so I love each and all of my followers, and thank you to you ladies, because I'm, a full-time practicing clinician, and medicine's it's a strange world, and we need all the voices, and thank you for what you do too.
Yeah.
Absolutely. Thanks for coming on. We appreciate it.
Thank you guys so much for listening to this episode. And if you love this episode, please leave a review. It only takes a couple minutes. And you can find out more about us on drbeckycampbell.com. And you can follow us over at Instagram on @HealthBabesPodcast, @Dr. Becky Campbell, and @Dr. Crystal Hone. Have an amazing day.